Welcome. I am Terry Tropin, and today I'll be describing diagnosis and procedural coding for the different types of hernias. Let me start with some information about myself. I have a master's in healthcare administration informatics from the University of Maryland Global Campus and have RHIA and CCSP certifications. I'm also an AHEMA approved ICD-10 trainer. I taught health information technology at Montgomery College for over 20 years. I retired in December. I also have books on coding. You can see these here. These are available on Amazon and are updated every year. I have evaluation and management coding made easy, ICD-10-CM coding guidelines made easy, and ICD-10 PCS coding guidelines made easy. If you would like to purchase a copy of the slides in this presentation, give me a thanks of $5 or more and comment with your email. Send me your email. I will send a PDF copy of the slides. Click the thanks button under the video. So this is an overview of the presentation. So I'm going to talk about some general terminology for hernias. Talk about inguinal hernias, femoral hernias, umbilical hernias, ventral hernias, diaphragmatic, hiatal hernias, other unspecified hernias, and those are all diagnosis coding. Then I'll go into the PCS coding, and then I'll talk about some notes that you can make in your book to help you remember all of this. So a hernia is when an organ or tissue moves from its original position. So it goes through an abnormal opening or a weakness in the body. So the abdominal wall, for example, is weak and the other tissue just kind of moves into it and pushes it out. Now, coding depends on, in some cases, whether it's congenital or acquired, and that's true for diaphragmatic or hiatal hernias, the type or site of the hernia, whether it's obstructed or gangrenous. If it's documented as obstructed and gangrenous, use a code for gangrene. So this is important. Whether it's unilateral or bilateral, or whether it's initial or recurrent. Okay, hernias are found in categories K40 and K46 in the digestive system. You'll note that the digestive system has no guidelines. It says for future presentation, and so there's no guidelines in here, so we can kind of get it from the notes within the codes, but there's no specific official guidelines. So K40 through K46 include acquired hernias, which occur anytime after birth, and congenital hernias, which are present at birth. There are, however, separate codes for hiatal and umbilical hernias that are congenital. So in most cases, whether it's acquired or congenital, it doesn't matter, but that's different guidelines for hernia and umbilical. Now, there's also a recurrent hernia is also coded in this category, and we'll talk about those terms in a minute. So let's start defining some terms. One of the big things for me is when they throw out terms and then don't define them. So let's define our terms. Reducible and irreducible. Reducible means the hernia can be manipulated to return the displaced structure back into position. So it's moved back to where it started. Irreducible means the displaced structures cannot be returned at the normal position by manipulation, meaning the physician can't just push the tissue back to where it started. So reducible and irreducible. These codes also use the terms strangulated or incarcerated. Strangulated or incarcerated is a hernia. Number one, it's irreducible, but in addition to that, the blood supply to the herniated tissue is restricted. And you can see that from this picture. It's squished so that the blood supply is reduced. When this happens, this may result in gangrene, and this is a surgical emergency. You don't want tissue to not be getting its blood supply. Very dangerous. Hernias may be documented as with gangrene or gangrenous. Gangrene means that necrosis or death of tissue due to loss of the blood supply. And I tried not to get gross pictures in this presentation. This is the grossest one I have. The rest are basically drawings because hernias are not pretty. The codes include digits for with obstruction as the fourth digit. This means that if it's with obstruction, it's irreducible, incarcerated, or strangulated. Okay, so all of this, you can see here, it's blocking a passageway. The codes also include digits for gangrenous with obstruction. So in the index, if it says hernias, the main term, of course, and then with obstruction, that means the hernia is irreducible, incarcerated, or strangulated. In the index, you'll also see gangrenous and then parentheses with obstruction means with or without. Remember, when it's parentheses, it means with or without. Indicates gangrene is present, and gangrene is definitely present, but obstruction may or may not be present. So if it says gangrenous and with obstruction, you're going to use the code listed for gangrene. The gangrene takes precedence. So a hernia may also be classified as unilateral or bilateral. This only, you know what unilateral and bilateral means, one side, both sides. So inguinal hernia and femoral hernia are the ones that will include unilateral or bilateral. Inguinal, the intestine moves into one or both sides of the groin. Here, femoral, it's moving into one or both areas of the thigh. A hernia may be documented as recurrent or not specified as recurrent. Recurrent means it was repaired previously, but another hernia occurred in the same location. Okay, so the codes talk about recurrent and not specified as recurrent. We will assume that if a hernia is recurrent, it will be documented as such. We're going to assume that the physician's documentation is correct. So if it's not documented as recurrent, we're going to assume that it's not recurrent, and we're going to use the code for not specified as recurrent. A hernia may also be documented as incisional. This means that it's herniation through a surgical scar. The scar tissue may be stretched and thinner, making it weaker, meaning that other tissue can move through this hernia, this skin, this tissue. So this occurs in ventral and abdominal hernias. You might also see documentation for peristomal. A stoma, as you remember, is a surgically created opening in the body, like a colostomy, when part of the colon is removed, and so they have to make an opening to the outside of the body for removal of feces. So they made a stoma. Sometimes there is a herniation through the opening in the stoma. You can see here in the top picture, this is a stoma right here. And here you have in the bottom picture, the herniation of the intestinal tissue with the stoma. This occurs in ventral and abdominal hernias, category K43. K43.0 to K43.2 are incisional hernias. K43.3, K43.5 are peristomal hernias. So let's start with the different types of hernia. First, we'll talk about inguinal hernias. In this kind of hernia, the intestine herniates or moves into the groin area. You can see right here. So the muscle wall is weak, and therefore the tissue moves through it. Now these codes, you'll have unilateral or bilateral, with or without obstruction, recurrent or not, and with and without gangrene. So be careful with choosing these. There's a lot of things to consider and look for. So an inguinal hernia may be documented as bubonocele, direct inguinal hernia, double inguinal hernia, indirect inguinal hernia, NOS, oblique inguinal hernia, and scrotal hernia. So lots of different words for this. So first it talks about indirect and direct. Now this is maybe documented by the provider, but there's no difference in the codes themselves between indirect and direct. But as I said, I have this thing about defining terms. So let's talk about what these terms mean. So what it means is how deep the herniation is. For an indirect, the tissue herniates through the deep inguinal ring, passes through the inguinal canal, lateral to the inferior epigastric artery. And that's this one. So you can see there's the deep inguinal ring and it goes into here. A direct inguinal hernia, the tissue herniates between the inferior epigastric artery and the rectus muscles. So it's not quite as far. So remember, the codes themselves do not differentiate between direct and indirect. Okay, let's talk about femoral hernia. In this case, the intestine herniates into the femoral area, so into here. Inguinal is going through here. The femoral is going through here. Now there's specific codes, again, for unilateral or bilateral, with, without obstruction, whether it's recurrent or not, and with or without gangrene. So again, a lot of possible documentation to look for. Hernias may also be documented and may also be umbilical hernias. So in this case, the intestine herniates through the umbilicus, the navel or the belly button. You can see there's the belly button, and tissue will go out through there. There's specific codes for with or without obstruction and with or without gangrene. You're not going to have a unilateral, bilateral for this one. It's also called periumbilical hernia. Now, this is one of those exceptions if the hernia is congenital, an umbilical hernia that's congenital, you do it to use a congenital code, a Q code, Q79.2 for umbilical. Okay, ventral hernia is when the intestine herniates through a defect in the muscles of the abdomen. So here you go. There's specific codes for with or without obstruction, whether or not it's recurrent, with or without gangrene. And then again, as I said before, peristomal or incisional. These are classified as ventral hernias. So there's really a lot to look at through the documentation for these. There's also other. So if it's not documented as peristomal or incisional, you're going to use a code for other. Again, we're going to assume that if it's peristomal or if it's incisional, the physician will document it that way and you'll have the information. So other, we're going to assume that it's neither one of those. The next type of hernia is diaphragmatic or hiatal. The esophagus passes through the diaphragm, through the hiatus, which means an opening. And therefore, this is called a hiatal hernia. So what happens is in the esophagus passes through the diaphragm and something herniates back through the that opening, okay? So the specific codes for with or without obstruction, whether or not it's recurrent, and with or without gangrene. Again, if it's congenital, you're going to use a code from the congenital Q codes, not this code. Okay, so for a hiatal hernia, it may be documented as hiatus hernia or esophageal sliding hernia. That means the tissue slides up into the chest through the diaphragm. This is a better picture than the previous one. You can see it's supposed to go this way, but the tissue is moving up through there. So it might be called a paraesophageal hernia. So different names meaning the same thing. Okay, so let's do a practice. If you would like to code this on your own, pause the video and return when you are ready. So let me read the video. The practice. Patient presents with incarcerated right femoral hernia. Okay, the answer is K41.30. In the alphabetic index, the main term is hernia, and then there's a subterm incarcerated. But that says go to hernia by site with obstruction. So this is saying if it's incarcerated, it's obstruction. So then we, as we talked about previously. So then you go to hernia, subterm femoral with obstruction, and that gives you K41.30. Okay, so here is another practice. Again, pause the video if you want to try this on your own. Patient presents with gangrenous umbilical hernia. So in this case, the answer is K42.1. So find in the alphabetic index, find main term hernia, and then umbilicus, umbilical, and then under that is gangrene, parentheses, and obstruction. Okay, so it doesn't. Remember that words in parentheses may or may not be present, but it's gangrene. So gangrene takes precedence over obstruction. So you end up with K41.1, sorry. Okay, K45 is for other abdominal hernias, those that are not documented as inguinal, femoral, or other types that we've discussed so far. So let's look at these briefly. There's specific codes in this category for with and without obstruction and with and without gangrene. These may be lumbar, obturator, pudendal, retroperitoneal, and sciatic hernias. So let's look briefly at each one of these because these are terms that you don't see all that much. So a lumbar hernia involves the lumbar triangles shown in this picture. Right there. And there's specific codes for with and without obstruction and with and without gangrene. An obturator hernia is in the pelvic area. You can see it's right here. And so the obturator foramen or opening near the obturator vessels and nerves. Okay. This is most frequent in patients with ascites, chronic constipation, COPD, and thin, elderly, multiparous women. Women have had a lot of babies. Specific codes for with or without obstruction and with or without gangrene. A pudendal hernia involves the perineum or pelvic floor. The pelvic floor includes the muscles between the tailbone and the pubic bone within the pelvis. These include the urinary and female genital organs in this area. So you can see is a hernia. Here's some hernias. So it's in the muscles in the pelvic floor. And there's specific codes for with or without obstruction and with or without gangrene. A sciatic hernia also involves the pelvic floor, but the herniation is through the foramen or opening. So here. So this may involve herniation through the foramen and the pelvic floor, may cause sciatica pain, nerve pain, often occurs in patients post-operatively and following trauma. So there's specific codes for with or without obstruction and with or without gangrene. So a retroperitoneal hernia involves hernias that push through the peritoneal membrane around the abdominal organs in the space behind it. So you'll remember from your anatomy classes that around all the organs in the abdominal cavity, there is a membrane kind of holding everything together. So this is a herniation that goes outside the peritoneal space, pushes outside the peritoneal space. Often occurs post-operatively and also with trauma. So the specific codes for with or without obstruction and with or without gangrene. So category 46, so that category 45, that's the other. So category 46 is unspecified. So these include epilasial, intraceal, hernia NOS, interstitial, intra-abdominal. So for these, there are also specific codes for with or without obstruction, with or without gangrene, and a note excludes vaginal intraceal. So K46, unspecified abdominal hernia, includes interstitial. This is between the layers of the abdominal wall. These are all the layers, and you can get a herniation between these. Specific codes for with or without obstruction, with or without gangrene. This occurs most often in children as inguinal hernias related to undescended testes. So an epiloceal is a herniation involving the omentum and the intestine. So the intestine is kind of an apron of fat tissue on the surface of intraperitoneal organs, like think of an apron over the, some of us have more of an apron than others. So this is outside the omentum. You can see the omentum is here. And so the hernia, the tissue pushes through the omentum. So there's specific codes for with or without obstruction and with or without gangrene. So also an enteroceal, the intestines prolapse, move downwards to the top of the vagina. So this is normal. Here's the vagina. And in this case, the intestines move down into the top of the vagina. So there's specific codes for with or without obstruction and with or without gangrene. So other ones in K46 category include hernia NOS, so not otherwise specified. Documentation just says hernia. It doesn't tell you where or any other information. Intestinal hernia, also not enough information. Intra-abdominal, and for these there are specific codes for with or without obstruction and with or without gangrene. So pretty straightforward. That covers diagnostic coding. Now a little trick here. Let's look at the procedure coding with ICD-10 PCS. Now this is not done in the digestive system codes. This is done to anatomical regions general and anatomical regions lower extremities. And also it's in the index under herniorrhaphy, which means repair of a hernia, but if you look up repair, that's going to just confuse you. So in the index, find herniorrhaphy, and under there, it will say repair anatomical regions general and give you 0WQ, anatomical regions lower extremities, 0YQ. If mesh, that's the one you use if mesh is not used, it's a repair. If mesh is used, it's a supplement. Anatomical regions general, 0WU, anatomical regions lower extremities, 0YU. So it's either a repair or a supplement, depending on whether or not mesh is used to reinforce the weakened tissue so that the herniated tissue does not move back again into the weakened tissue. So it's like putting up a wall so that the weakened tissue is stronger. Okay, so body part values. What body part values are used in these body systems that relate to hernias? So in the general anatomical regions, which is 0W0 to 0WY, you've got abdominal wall, peritoneal cavity, retroperitoneum, pelvic cavity, upper and lower back, and gastrointestinal tract. So depending on which kind of hernia you're talking about. Anatomical regions, lower extremities, you have inguinal region, right, left, and bilateral, digits 5, 6, or A. And then femoral region, right, left, and bilateral, 7, 8, and E. So we know the first digits, and then you have to select the appropriate body part value. So in order to select the correct PCS code, you need to know where is the hernia, is it unilateral or bilateral, and whether or not mesh is used. So let's do another practice. Again, if you wish, pause the video and code on your own. So this is bilateral direct inguinal herniorrhaphy open. So the answer is 0YQA0ZZ. So in the alphabetical index, you look up herniorrhaphy. It says see repair, inguinal region bilateral 0YQA. This is a repair because there's no mention of mesh. We're going to assume that if there was mesh used, the provider would say that. So we're going to medical and surgical section, which is 0, lower extremities, which is Y, repair, Q, inguinal region bilateral, A, approach is open, no device value, no qualifier value, and we end up with 0YQA0ZZ. Okay, one more practice. So in laparoscopic repair of umbilical hernia with mesh prosthesis. So the answer is 0WUF4JZ. In the index, find herniorrhaphy with synthetic supplement, since we use mesh in this case. So we're going to use supplement, not repair. So C, supplement anatomical regions general 0WU. Okay. So it's medical and surgical 0, anatomical regions general W, root operation supplement U, body part abdominal wall F, approach percutaneous endoscopic 4, because that's laparoscopic procedure. Device synthetic substitute J, and no qualifier value. That's a Z. So it's impossible to remember all the guidelines and keep all of this straight. So here's some suggestions of notes to write in your ICD-10-CM book to help you remember. So in the alphabetic index, find the main term hernia. So go through it. This entry includes a number of different types. So I would recommend go through and highlight the main subterms, inguinal, femoral, the kind of hernia. That will take your eye to those right away, and you'll be able to find them more quickly. Under the femoral and inguinal, highlight or underline bilateral and unilateral. So you remember that you need to have that subterm. In the tabular list, if you want to write in the definitions of types of the hernia in there so you remember what it means, you can also write in obstructed equals irreducible, incarcerated, and or strangulated. So you can write that in to remind you that irreducible, incarcerated, strangulated are all done as coded as obstructed. Okay, so what about your PCS book? I would go into repair and write in C herniorrhaphy, and that to refer you back to where the hernia codes are. If you go to the entry for herniorrhaphy in the index, where it says herniorrhaphy with synthetic substitute, write in that it means with mesh. Synthetic substitute means with mesh. Okay, that completes this video. If you have questions or comments, please feel free to contact me. If you would like to purchase a copy of the slides for this video, give me a thanks of $5 or more and comment and type into the comment section your email, and I will send you a PDF of the slides. If you enjoyed this video, please give it a like and or subscribe by clicking on the picture in the lower right-hand corner. So again, here are my books. E&M coding, ICD-10-CM, ICD-10-PCS, and here's the link to it. If you have comments or questions, here's how you can comment, how you can contact me. I get some interesting questions every once in a while, which makes you think, oh, I should write a video on that. So your comments or questions are really very helpful for me. Okay, thank you very much for listening. I hope this was helpful. Bye.